Okay, excellent. So as Frederick said, I am with the SHIBA program. If you're not familiar with that, it stands for Statewide Health Insurance Benefits Advisors, which is quite a mouthful. In other states, it's called SHIP, but frankly, we started it here in Mount Vernon, Washington in 1976. So we're going to stick with that acronym. And it's free and unbiased for folks. And that's important because sometimes people go to insurance brokers for advice. And the catch is that the insurance brokers are paid by insurance companies. And so there are plenty who have good integrity out there, but there are also plenty who want to funnel you toward their insurance companies. So we like to provide, this free service as much as possible to anybody in Thurston and Mason counties. But there are SHIBA offices all across the state. I have a team of 15 volunteers. Some of them have been doing this for 15 years. So there's an incredible amount of knowledge. And frankly, it takes that because just when you think you know Medicare, it changes slightly. And, every single year it changes. Now, I'm going to give you a very brief overview of what Medicare is, just in case you don't know. So Medicare is health insurance for people over the age of 65, or they might be under 65, but they are deemed disabled by the Social Security Administration. They have end-stage renal disease or Lou Gehrig's disease, and they have to have been a permanent legal resident for at least 5 continuous years. Basically, they have to have a certain number of work credits accrued. Okay? Now, when I was younger, I just always assumed that healthcare would be free for me after a certain age. It is not free. It is totally not free. So these are the 4 parts of Medicare. Part A, think A for admitting. A is the hospital insurance. This typically is free for folks if they have enough work credits, and most people do. But Part B is the medical insurance. That's the big mamba jamba, and this is not free. It goes up a little bit every year. Last year it went up for the first time in a while by a big jump. So it's $202.90 now per month to have medical coverage through Medicare. So it's quite a bit, and yet you don't want to be without it. In fact, you can't be without it. If somebody is on Social Security, they will automatically be signed up for Medicare, at least Part A and B, original Medicare, when they turn 65. If somebody doesn't sign up for Medicare when they're supposed to, and they try to later, they will incur a late penalty. And it's not just a one-time penalty, it's every month for good. They have to have Part D as well. Think D for drugs. D is the prescription portion. So there are 2 options here for folks. They can either sign up for just the basics, A, B, and D, and stick with that, or they can sign up for Part C, which kind of combines those Medicare Advantage plans. There's no right or wrong. It really depends on a person's needs. Okay. The advantage to just signing up for original Medicare, just the A, B, and D, is that you can go to any doctor, that you don't have to worry about networks. You don't have to worry about if you're out of state. Here's the catch. It doesn't pay for everything. Very few insurances do anyway, but this pays for 80% of your care. It means the other 20% is up to you, plus the Part B cost, right? Plus you have to pay for a Part D plan, which usually isn't that much. But so these are important, and also dental, right? Because dental is not covered as part of that. So those are the catches. If you do that, most people end up buying a supplemental Medicare supplemental plan to pay for that 20%. And those can get to be kind of expensive. It's certainly easier to go for a Medicare Advantage plan, a Part C, that incorporates, you have to search, but make sure it covers dental coverage and prescription coverage. But the drawback to that is that those are all administered by private companies. And as you've heard on the news, many of them are known for denying claims. They say that they cover things like chiropractic care or physical therapy, but when those physicians put in the claims, they're denied. So there are, pros and cons of each route. Before I go on, any questions about this? Because I've covered it really quickly. Okay. So let me see. Enrollment is not automatic. It used to be that everybody was on Social Security by like the age of 60, but it's not the case anymore. So many people, when they turn 65, are not drawing Social Security yet. So they have to actively enroll in Medicare. Railroad Retirement Board will automatically sign you up. Those are few, but I haven't met one person who is on railroad retirement. If you're on Social Security, you will be automatically signed up. You do need to enroll on Medicare through Social Security, which is kind of confusing, right? That's a little weird. Or if you're with the Medical Retirement Board. Why is this important? Okay, so if you are turning 65, you have to enroll in at least Medicare Part A, but you don't have to enroll in Part B if you're covered by your employer's plan and they have creditable coverage. So that's cool. That will save you that premium. Or your spouse's plan might cover you and they're creditable, meaning they have over 20 employees and they're recognized by Social Security as good health care. But if you're not covered by creditable coverage, you really want to consider signing up for Part B, because later on, if you try, they will get you with a major late fee. Okay. Why is this important? Because the Social Security Administration does not recognize VA healthcare as creditable coverage from an employer. So when I was new in my role, I had a veteran show up with his daughter, and he had been on VA healthcare for years. And, he's totally covered by, for most things except dental. And when it came time for him to sign up for Medicare, he signed up for Part A. And he said, well, I figured I'd save them and me some money by not signing up for B, because I have health care through the VA. Makes sense. Made sense to me at the time. But he said after his wife passed, he started getting frustrated with how hard it was to get in to see his VA doctor. And he thought, maybe I'll just sign up for Part B. They were going to charge him over $500 a month. Now, I was very angry on his behalf, and I called the Social Security line and I got a hold of the supervisor. And she said, no, we do not recognize VA healthcare as creditable coverage, which means he should have signed up as soon as he turned 65. And I said, but this is crazy. It is healthcare. And she said, well, not creditable coverage from an employer as we would recognize it. And she said to me, you would not believe how many veterans I have to explain this to after the fact, which told me that a whole lot of us on VA healthcare are not aware of this. And I wanted to make it my mission to put this information out. Here's the weird thing. They actually, Social Security and Medicare, recognize VA healthcare prescriptions as coverage for Part D. So You don't, you can sign up for Original Medicare A and B and not worry about Part D if you have VA prescription care. Why in the world they recognize Part D or the prescription coverage, but not the healthcare coverage, does not make any sense to me at all. But this is the way it is. So weird, I know. Now, most retirees don't run into this problem because they're already on TRICARE. And once they turn 65, TRICARE becomes TRICARE for life. And they are very clear about saying, look, you have to sign up for Medicare Parts A and B if you want TRICARE coverage. The reason why is they want Medicare to pay the initial charges, and then they act as the secondary coverage. You still have to pay the Part B premium. So I'll be in this boat when I turn 65. I'll have TRICARE for life. I'm just going to have to suck it up and pay for Part B premium. But at least TRICARE will cover that 20% that Original Medicare doesn't cover. TRICARE will cover all the copays and deductibles. So pretty much TRICARE for life will act like a Medigap or a Medicare supplemental plan. So there is no need for any retiree to ever buy a supplemental plan. That will be what TRICARE for life does. So they'll be covered by both Medicare and TRICARE. They have to sign up for Medicare Part A and B. There's no getting around that. So that's very different from the VA coverage. Now, what are your questions? I've gone through this really quickly because it is a quick presentation. So, oops, sorry, my dog is joining us. What questions do you have, or comments or concerns?
The couple of questions we have are, what if you have TRICARE and spouse uses VA?
Okay, excellent question. Medicare does not, well, let me see. Okay, so if you have TRICARE, your spouse is not on your TRICARE plan, they're just covered by VA. So they're a veteran in their own right. Okay, so you guys have both. Okay.
Yep.
So so here's the important thing to know about Medicare. Each person has to sign up for Medicare on their own when they turn 65. So your spouse, it sounds like you're both retired, so both of you will have TRICARE for life when you turn 65. So you and your spouse will both have to sign up for Parts A and B. Okay. So you should both be covered. The important thing is you can still keep VA healthcare and TRICARE, right? You can do that if you want to, and like get your prescriptions for free, or maybe you really like your VA provider. That's awesome too. Mercy. Shh, 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 shh. There's no harm in that, but just know that you've got to sign up for Medicare Parts A and B at a minimum when each of you turn 65. Yeah, that does explain why TRICARE for Life told you to enroll in both A and B. Yeah. You know, what tends to happen is people turn 65 at a different time, and that's fine. It's just you need to both be aware of what the requirements are and sign up for for Medicare on your own when you turn 65. And the fact that you have TRICARE for life as well as VA is good. Aaron, do you have a question?
Yeah. And so let's say, for example, You have basically US Family Health Plan is basically a TRICARE for life is what that is. Okay. And so say you have that currently right now, you're making premiums on that and you're a state employee, right? And you have benefits to the state, okay,
Mm-hmm.
that you're also paying for, right?
Mm-hmm.
And so when you turn 65, since the state benefits is considered credible insurance, you
Mm-hmm.
wouldn't have to sign up for TRICARE Part B until you're done working for the state, correct?
No, you wouldn't have to sign up for Medicare Part B until you're done working for the state, typically. But if you want to keep TRICARE for life, it's their requirement that you sign up for Medicare A and B. Now, you might be able to argue with them that, I have creditable coverage through my employer. I would recommend that you contact them, and find out if they will accept that. The important thing is they don't want you to ever use them as primary insurance if
Hmm.
you have Medicare. Um,
Right.
so,
I don't use them as primary now.
okay,
I use the state, and they're always my secondary, even now.
okay. Right now you're on just TRICARE, right? You're not 65 yet, but
I'm
um,
approaching. I'm close. So
okay. I don't know how hard and fast that rule is if you're still working and you have creditable coverage through your employer. I would contact them directly and make sure, you know, do I have to sign up for Medicare A and B no matter what? Or is my coverage through my employer going to satisfy that? And see what they
okay,
say, because they're really going to be the experts on that. But you want to make sure that you're abiding by their rules. It's good you're
okay,
thinking ahead.
yeah, yeah,
And anything that can save you that Part B premium, I mean, it's not going to go down,
yeah. Well,
unfortunately.
I talked to them before about this, and they told me that the USMA Health Plan. They told me what happens is once you do sign up for Part B, they become your Part B. So you no longer pay them the premium that I've been paying them uh, before I get to Part B now. But that premium that I'm paying them now, I don't pay anymore because I'm paying for Part B. And so they actually become my Part B is what they told me. But I will ask that question though, that if
Yeah,
the other question too, to make sure I'm not required to sign up for Part B
right.
uh, prior to me done working for the state. So
Yeah. Yeah. And you usually have a certain amount of time after you stop working for an employer. You have a certain number of months to sign up for Part B if you're 65 at that point. But also, if you decide to retire from the state, then you need to look at the retirement
right,
coverage and how that's going to play with the TRICARE for Life and the Medicare.
yeah, exactly.
Yeah,
Yeah,
good thing to plan ahead for that and make sure that everybody's playing well together. The VA, unfortunately, does not play well with others. So VA healthcare is what it is, and it's all by itself, except for prescriptions, weirdly. But that's the important thing to know, because so many of us, when we first get out or retire or whatever, are well under the age of 65. And so we just don't realize that this VA healthcare we've come to think of as coverage will not satisfy Medicare. So that's the important thing for your folks to know. Okay. And if anybody has any questions, they are welcome to contact our SHIBA office. Let me see, 586-6181. I will put that in the chat. That is our local number. We are at the Olympia Senior Center, and we're very happy to help anytime. Oh, you're still muted.
Oh, okay. Thank you. If there's no more questions, I don't see any. Thank you, Dr. Hudson. I greatly appreciate it.
My
Um,
pleasure.
Thank you everyone for attending this webinar. The next webinar is at 12 noon. And it is Your Commute Shouldn't Be the Hardest Part of Your Day, presented by Kylie McPherson from the Inner City Transit. I'll post the link in the chat here in a second. And we appreciate it. Tomorrow, if you're in the Olympia area, Kelly will have a booth at our in-person wellness fair at the Liquor Cannabis Board, located on 1025 Union Avenue Southeast, Olympia, Washington, right next to us, from 10 to 1. Feel free to stop by, talk to her or any of our other 25 vendors, including puppy and kitten cuddles, a blood drive, and flu shots. Thank you.
Puppy and kitten cuddles. I had no idea. That's
Yeah.
awesome. I'm
Stop
there.
by. Stop by.
Okay. Bye, everybody.